Good morning, everyone. Thank you for making the journey here to Girdwood on this very cold and frosty morning, and thank you to those who've travelled a good distance to be here. We really appreciate it. We're delighted. There's so much interest in this thematic area of health, and we're going to be talking to you about it all morning this morning. My name is Paul Boyle, and I'm one of the programme managers with SEUPB. I'll be helping compare the event today, and I'll hand over to my colleague Declan McGarrigle in a few moments, who will take you through a bit more detail. There is no fire alarm planned for this morning. If the fire alarm does go, we congregate in the car park just outside the building. Obviously, if you can't get out that way, to the right, you turn to the left. The bathrooms are directly opposite this room, just behind the reception. So if you need to use the facilities, they're just there. Please do help yourself as and when you need. There's also tea and coffee in the back left. Lunch will be served a bit later on this afternoon. It's a cold lunch, so we are available from around sort of 12ish. We'll see how things go. So without further ado, I'm going to hand over to Declan to get the proceedings underway today. Thank you.
Good morning, everybody. And just to reiterate really what Paul was saying, just to welcome everyone here today. And I know some of you have travelled some distance, so in particular you're welcome here to the Girdwood Centre. And of course, this is one of the projects which has been funded by the PEACE4 programme and the PEACE programmes in the past. So it's good to have you here with us today. Today's really about introducing and starting the process for project development, pre-application support, as we call it, under the PEACEPLUS programme for investment area 4.1. So it's a short session, but it's the start of the process, and we want to be engaging with all of the projects that are going to be developed under this investment area from an early stage. So it's really important that you engage with us, take part in the process in terms of pre-application support, and we're there to provide advice and guidance throughout the next number of months. The programme itself, just to give you a little bit of an update, we have obviously been working on the development of the programme now for a number of years, and many of you will have engaged in the development process through the consultations that we had, including the statutory consultation that was held in 2021. That process concluded in July of this year when the European Commission adopted the PEACEPLUS programme, and that was a really important step for us in terms of having the programme really ready to go and to start the implementation process. So we're now moving into really implementing the programme. The pre-application support is obviously an important part of that process, and we're hoping and we should be ready to begin to launch calls really early next year. That's something that we'll give more information on as soon as we can in terms of being more precise around dates and things like that. But what we can obviously give you a little bit more detail around is the process for pre-application support, and Myriam Fearon is working with ourselves to provide that support, and she'll engage with you today and also then over the next couple of months in terms of the concept note process. I also want to welcome our colleagues from the two government departments, North and South. So Jaqueline McDevitt from the Department of Health in Northern Ireland, and also Lorna Conway, were both from the Department of Health in Ireland. Mary Talley and I think Jonathan Patchell as well from the Department of Health in Ireland, if he's not here already, will join us shortly. So Lorna and Jaqueline will give an overview of some of the policy requirements and some of the policy context from the two governments, North and South, which obviously have fed into the development of the programme, and also in terms of our expectations for project development as well. So just, I suppose it's a little bit of a start and to give you a little bit of context before I ask the two departments to come up. and also before Myriam provides her overview of the process for pre-application support. I think it's important to say that the PEACEPLUS programme and indeed investment area 4.1 on health and social care very much builds on what has been there before in terms of the Interreg 5A programme and indeed previous Interreg and PEACE programmes. So obviously many of you in the room will have been involved in Interreg projects before and cross-border collaboration. And this is our current programme, and many projects are still being implemented. Some projects have closed. But obviously health and social care was an absolutely critical part of the current Interreg programmes and indeed going back further. It's always been a really important area of cross-border collaboration by a range of different organisations onto the programmes. So you can see there was support for 4,000 socially isolated people. There was 12 cross-border health interventions for 15,000 beneficiaries, all to improve the health and well-being of people across the region. And indeed, Scotland, as well as Northern Ireland and Ireland, were all critical and important partners in that process. So, again, this is some of the results in terms of the current programme to date, in terms of health in particular. And you can see from the slide, there's over 50,000 patients benefiting from projects under the current programmes. And you can see some of the other statistics there and information in terms of the 4,500 patients receiving e-health interventions, 4,000 socially isolated people in community support services, and of course 15,000 patients in scheduled and unscheduled health streams. Obviously there was other areas in the programme as well, just to touch on those, sustainable transport with greenways, which obviously contributes in terms of a healthy lifestyle, and other projects under the environment and also research and innovation, and of course there would have been a health and life sciences element to that as well. So just important just to reiterate and to state that we really do see that this programme, and particularly under that investment area 4.1, will continue the good work that many of you have already been engaged in. We want to see that built upon under the PEACEPLUS programme. So just briefly, how do we get to the point where I suppose we're standing in front of you today and starting this pre-application support? And we've really reached this point through a detailed process of collaboration with the Northern Ireland Executive, the Irish Government, the Government of Ireland, and indeed the UK Government, and of course the European Commission. So together, a programme has been drafted that will contribute to a more peaceful, prosperous and stable region, the programme area of Northern Ireland and the border counties of Ireland. And we believe certainly that following this programme that there will be a lasting legacy, and I suppose all of you, I know, are on the same page on that, and as you start to develop your projects, really to be thinking about that sustainability and that lasting legacy from projects under this programme period. So it is an exciting programme. Certainly we believe it's an exciting programme, which will build, as I said, on the legacy of those previous PEACE and Interreg programmes. And of course, the big difference this time is that we don't have the two separate programmes. It's one single PEACEPLUS programme, but of course, with a value which far exceeds what the combined total of the current PEACE and Interreg programmes are. It's important to state as well that PEACE funding, PEACEPLUS funding, is distinct. And no matter what area of the programme you're applying to, you need to be thinking about the PEACE outcomes, how that is going to contribute to a more peaceful and indeed a prosperous society as well as obviously the ongoing sort of economic and territorial development of the programme area as well. I mentioned there in terms of the extensive engagement that has taken place over the last number of years on the development of the programme, and just to thank everybody that contributed to that process. We had stakeholder engagement element in terms of the development process right at the start of when we started to engage in this back in 2019, just before the pandemic. We had a range of public events right throughout the programme area. I think we had about 16, 17 of those in total. Well over 1,000 people came through the doors at those, but there was also a high number of formal consultation responses that were submitted, survey submissions, with people giving their views. All of that fed into the discussions and the development process for us with our government departments and also with the European Commission. And of course, it finished with a statutory consultation last year, which really reinforced the fact that the programme that had been developed was on the right pathway. And the bilaterals with government departments, North and South, continued right throughout that process. And it's important, obviously, that the programme fits within the policy context. And you'll hear a little bit more about that in a moment from the two departments. But it's important that the programme fits within the policy direction at a European level, but also North and South as well. And when you begin to look at your projects and start to develop them further, again, it's important to think about that context as well. So the programme itself has a focus in Northern Ireland and the border counties of Ireland, and that's where the primary benefit has to be. But you can see at the bottom, in terms of participation from partners outside the programme area, and that's something that we really want to encourage and see, where it can add value to the partnership itself. So is there expertise, is there knowledge, is there existing partnerships that you've already built which involve partners from outside the programme area, further south on the island of Ireland or in Scotland or elsewhere. So it's important just to note that that is something that we'd certainly be encouraging, providing it adds that value to the programme area. There's obviously, in terms of the budget, I think most people are aware by now of the significant investment that is being put into the programme by the governments, North and South, and also obviously by the European Union and the European Commission, and indeed the UK government as well. There's 6 themes and 22 investment areas. So again, I know many of you are here today to hear about investment area 4.1, but we do encourage you to look at some of the other investment areas as well, because there may well be a place, if your project doesn't fit within this investment area, that there might be somewhere else in the programme. It's a wide-ranging programme with many different areas of focus, and I think it's important that you look as widely as possible across that to see where things might fit. The programme, as I said, it's about peace and prosperity, and every project will be assessed against that. How are you meeting, how are you delivering through your project a more peaceful and prosperous society within Northern Ireland and the border counties of Ireland? Really important. It's a very simple graphic, but it really is what we need you to be thinking about. That bit in the middle is PEACEPLUS, but bringing in the peace and reconciliation benefits of your project, and also the more prosperous society as well. And you can see as well, I'm not going to spend a huge amount of time going through this, and I should say as well, if you go on to the PEACEPLUS page of our SEUPB.eu website, you'll find a lot more information in terms of a programme overview document which sets out each of these themes and each of the investment areas at a fairly high level, but it's a useful starting point as you begin to navigate your way through the programme itself. But you can see, the range of different themes and areas, from theme 1, which is about building peaceful and thriving communities. We have our focus on peace local action plans at a local level, but also more regional level projects as well on peace and reconciliation. Theme 2, where you have research and innovation, smart towns and villages, also developing skills as well. Theme 3, maintaining a focus on children and young people, and that's been an absolutely really important part of peace programmes, particularly the Peace 4 programme. but even going back to previous programmes as well. So empowering and investing in our young people through, again, soft skills, but also around shared education, shared learning, and also youth mental health. And again, there are areas in there potentially that might align with some of the thinking that you have as projects as well. Theme 4 is where obviously the focus of today is in terms of collaborative health and social care. But we also have rural development and regeneration in there. And, we talk a lot in there about social isolation, particularly in rural and peripheral communities across the programme area and beyond. And also a focus on victims and survivors as well. And then theme 5 is really a response to the issues around climate change and mitigations there, in terms of biodiversity, in terms of our coastal environment, water infrastructure, and also energy and cross-border rail linkages as well. And the final theme is theme 6, which is building and embedding partnership and collaboration. And this is another one I think there will potentially be health projects on, because it's about looking at barriers that exist because of the border, north and south. Are there particular issues around health and social care that could be addressed through soft projects of collaboration, around strategy, developing new strategies, about planning in a more effective way, and that can be at an institutional level with government departments right down through various organisations, NGOs or whatever else it might be. I should also say as well, one of the big flagship areas of the PEACEPLUS programme this time round is what we call our small grants, small scale projects. So there's 40 million euros that are going to projects that will be up to 100,000 euros. So it's important just to point that out as well. And they're in 2 areas of the programme. They're under theme 2, which would have a big focus, those small scale projects under theme 2 on peace and reconciliation. But it's also under theme 6 as well. And again, healthcare could be in there in terms of small scale projects, but the focus there is very much about cross-border. That's one of the requirements under theme 6 is projects have to be cross-border. So again, it's worth just having a look at that, particularly if you're from a smaller organisation and maybe you're thinking of a smaller scale project, but there are opportunities there as well. I just wanted to touch on, I think this is a useful sort of overview, I suppose, of the process in terms of where we are and where we need to go to, particularly from a project perspective, but also from our perspective as a programme as well. And you can see this is essentially a life cycle of a project. And really where we are at the minute is up at the top there, really at the start, that pre-application, the development stage. So trying to elaborate your project idea. And I appreciate here today, people will be at different stages, I think, in their journey here. Some people will be quite far advanced, and are quite well experienced, they've been through all of this before. But there'll be others that just really need some guidance and assistance in terms of even the idea itself. And, that's what Myriam is going to be there to support you on, wherever you are in that journey. But project idea, it's about turning that into a concept note, which Myriam will discuss later in terms of how that will work. And also around potentially partner searches. And I really encourage you today, and it's great hearing so much chatter just before we started, because I think these are good events now that we can do them in person, to speak to others. There might be partners that you haven't thought of, or maybe you're needing a new partner, or a different set of partners this time around. So do use today as an opportunity. This morning over lunch, to exchange details, and there is an opportunity to do that through our website as well, where you can put your details up through yourselves. We'll put it up on the website if you're searching for partners, and we can try and support you in that way as well. But you can see then we'll move on, to really the application process, and then through the contracting startup, and then we're in the project implementation, and indeed through the project closure. So just useful just to have that little overview of the life cycle of projects and the programme as well. So theme 4 is what we're here for today, and the investment area 4.1 And again, it's just a reminder where it sits within the programme. And talked there about 22 investment areas, and 4.1 is an investment area in its own right, and each investment area will have separate calls for applications. So obviously we're working towards being able to launch a call under this particular area of the programme in the very near future. As you said, probably at this stage, it won't be any earlier than March, April, something like that. Could be a little bit later, but we'll keep you informed through Myriam and through communication over the next number of months once we have further information on that. But it's an investment area in its own right today, and it will have its own call for application. And there will actually be 2 calls for applications at least under this particular area of the programme. And we'll set this out in a little bit further detail. We're focused on one of those calls, so it's separated into 2, which the first of those will be on just your cross-border collaborative health and social care projects, the similar things that you would have seen under the current programmes. That's what today's focus is on. There will be a separate call further down the line, which is around one of the actions that we've noted in the programme around addiction, around potential capital project around addiction services, and also not just capital and infrastructure, but also around how our services would be delivered. So it's just important just to note that, there's a number of actions under this investment area. The first action, which is cross-border health and social care collaborative projects that we're focused on today. And we'll take you through that in a bit more detail in a moment. So I'm going to keep quiet now, and I'm going to ask our colleagues and welcome our colleagues, Lorna and Jaqueline, from the 2 departments of health, who are going to give you an overview of the policy side of things from the 2 governments, North and South. Thank you very much.
Thanks, Declan. Good morning, everyone. My name is Lorna Conway, and I'm here this morning from the Department of Health in Ireland to provide an overview of the policy interests of our department, along with Jaqueline, who will be providing an overview of the policy interests for the Department of Health in Northern Ireland. Just to give some context, I'm based in the North-South EU and International Unit in our department, and I lead the team that works on North-South engagement. So I'll hand over to Jaqueline to do the introductions.
That's great, thanks Lorna. So good morning everybody. Let me just move the slide on. I'm Jaqueline, and I'm delighted to be here presenting with colleagues from the South on key healthcare policy issues relevant to PEACEPLUS. So the Department of Health in Northern Ireland is one of 9 government departments. It has 3 main business responsibilities, including policy and legislative responsibility for health and social care. So, for example, hospitals, primary care and community health, personal social services. The second responsibility is public health, including health promotion and protection of health and well-being of the population. And then the final one is public safety, which relates to fire and rescue services. Within our department, there are 4 business groups, of which healthcare policy, my area, is one. We also have 5 professional groups, each led by a chief professional officer. And you'll all be very familiar with our chief medical officer, Professor Michael McBride. So he leads the CMO group. We also have an Office of Social Services. We have a Directorate for Nursing, Midwifery and Allied Health Professionals, the Dental Services Directorate, and then the Pharmaceutical Advice and Services. So that then brings us to Directorate level. And the branch I work in, the EU branch, sits within the Transformation, Sponsorship and EU Directorate. But I'll talk a bit more about that later on. Right now, I'd just like to focus on our mission statement within the Department of Health, and I've deliberately picked out some words in bold there. And it might help to consider these in the context of potential project proposals you may have in mind and how they link to the Department of Health's strategic aims and policies. It's also worth noting that you will find reference, often frequent, to these phrases and words in relation to collaborative health and social care within the PEACEPLUS programme. And if you have a look on the SEUPB website, the programme there will give you all the information you need to know in terms of the words there which have been picked out in bold. So before continuing with the priorities and values of the department in Northern Ireland, it might help if I just give a bit more context in terms of the resources which are currently available to help us fulfil our policy priorities while striving to maintain health and social care values. So we have an annual budget of approximately 7 billion. 95% of this is allocated to our 16 arm's length bodies for running costs and service delivery, and the remaining 5% is for the department itself and its running costs. We also receive an annual capital budget of £350 million. Again, the majority of that goes to our 16 ALBs for delivery of new major projects and strategies, IT, research and development, investment in primary care, mental health, emergency services and ongoing maintenance of the health estate. You might be surprised to learn, I only joined the department last year, that it's one of the smallest in the civil service, and we have 558 full-time equivalent staff, with the closure of the Health and Social Care Board in March this year, seeing an additional 465 full-time equivalent staff working as part of our Strategic Planning and Performance Group and the Chief Digital Information Officer groups. But these staff aren't civil services, they still civil servants, they still remain within the healthcare service. So in terms of ensuring PEACEPLUS project proposals align with our priorities and values, I just want to focus on several key regional strategies, the key policy aims of which are reflected in the PEACEPLUS programme. And just to highlight too, that while the focus of today is on priority areas and programme for government and the aims of New Decade, New Approach, there are many other strategy documents, and you'll be able to find these both in New Decade, New Approach and Programme for Government, and as well as the departmental website. So, the Programme for Government framework, which I'm sure many of you are already familiar with, sets out the ambition that the executive has for our society. Its ambitions are generational in nature and intended to address big issues facing the region and to really make a difference to people and their lives in terms of health and social care. Again, to provide focus for how this investment area aligns with departmental aims, I'll summarise some of the key priority areas for health in Programme for Government. It's also worth mentioning too that many of the key priority areas that I'll reference here span the policy objectives of several departments, and there is cross-departmental engagement to ensure a joined-up approach to delivery. So, first of all, just looking at access to health, this is really about taking forward health and social care reforms to ensure delivery of safe, high-quality services to meet future challenges and provide the right services where they're needed. The inclusion and tackling disadvantage. This is a theme that we're going to hear a lot about today. It's about addressing issues that lead to inequality and disadvantage in terms of health and healthcare. Early years is really about action to reduce, again, health inequalities and should start before birth and be followed through the life of the child. Mental health and well-being, again, this is a significant theme in PEACEPLUS, which we'll hear a lot about. It's about promoting positive attitudes towards mental health and well-being and ensuring access to early intervention and treatment services to address mental health issues. Older people, again, we're familiar that thanks in no small part to the success of our health services, people are living much longer, much healthier lives. So older people, it's about being mindful of the needs of an ageing population, promoting positive attitudes to older people and tailoring support to enable them to enjoy better health and active lifestyles. Physical health and well-being. So this concerns promoting positive public health measures, increasing awareness and supporting safe, active and healthy lives. Capability and resilience. It's about equipping children and young people with knowledge and support to help them make safe, healthy and sustainable choices. And finally, care focuses on providing stable, nurturing environments for looked after children, those formerly in care, and newcomer children, to make sure they get the best possible standards of support. So looking at New Decade, New Approach, and I'm just going to move on and rise above this next statement. I'm sure you'll all bear with me, and hopefully we'll be back to a restored executive soon. So NDNA underpins restoration of devolved government in Northern Ireland in 2020, with actually the first main priority that's stated in this document is about reform and transformation of the health service. So this includes action on waiting times, on delivering on HSC reforms as set out in Professor Bengoa's 2016 report, Systems Not Structures, and the Department's response to this, the ambitious 10-year plan, Health and Wellbeing 2026, Delivering Together. And I would encourage you to have a look at the Health and Wellbeing Delivering Together strategy document, because a quick glance at its contents page again flags up recurring themes we've already mentioned today regarding the need to address health inequalities, supporting an ageing population, building capacity in communities and in prevention. And again, we'll touch on this later, but we've had some fantastically successful programmes for Interreg 5A, where it's all been about supporting care in the community. So enhancing support in primary care, another priority within Delivering Together, and reforming our community and hospital services. So a little bit about the branch. It was established in autumn 2022 in the newest of our departmental directorates. And while we cover a variety of policy areas, as you'll see here, I just want to focus on the EU programmes and North-South Cooperation branch, which is where I'm based. And just to say, we love engaging with our European colleagues, and whether this is colleagues in the South or in Brussels, and it makes a lot of sense, given that we have many shared challenges that we all face: increasing demand, finite resources. So yes, it makes a lot of sense to take an outward-looking collaborative approach to working with a wide range of stakeholders and service users to address these shared challenges locally and globally, which again is exactly what PEACEPLUS speaks to. It also helps avoid duplication of effort, which drives me crackers, and to pool expertise to address shared problem and ensure maximum utilisation of scarce resources. And we've seen this through many demonstrable successes of the Interreg and Peace programmes, and again we'll touch on those later. And it may help to bear all of this in mind when considering who your potential cross-border partners may be. And I'll come back to what's going on in that picture very, very soon. And so while we're here to focus on PEACEPLUS, this slide just illustrates the key areas that my branch are focused on. And so I'm here today to talk to you about PEACEPLUS and look again at the success of the Interreg programme. But I just want to take a few seconds to talk about our European networks and why they're so beneficial to us. And this is because it has really helped us showcase successful cross-border projects at European level through our membership of two networks in particular, Eurega and the Reference Site Collaborative Network on Active and Healthy Ageing. So in March this year, the EU branch and Cooperation and Working Together colleagues, who I'm delighted to see are here today, we were able to present on the success of current Interreg 5A cross-border initiatives, along with EU regions who also participate in similar Interreg programmes. And I'm not sure how many of you know this, there's actually 60 Interreg programmes are going on at any one time across Europe. Then not long after that presentation in March, as part of the European Week of Healthy Cities, the Department and COT were again given the opportunity to deliver a presentation on the successful outcomes of the cross-border community paramedic strand of the acute hospital services project within Interreg. And we've just had a successful closure event for that project as well. Needless to say, the shared learning from engagement for the branch and the wider department is absolutely invaluable. So just moving on to my last couple of slides, I want to expand a little further on the benefits of networking with EU colleagues. EUREGA, which I mentioned previously, aims to bring regional and local health authorities together to improve health policy in Europe and establish and promote collaboration between its members. The RSCN, meanwhile, the Reference Site Collaborative Network, is a network for all reference site regions promoting a life course approach to active and healthy ageing, again, very relevant for the sorts of themes we're looking at today. And just as you'll be well aware, these connections and cross-border engagement have been vital with regard to learning from others, sharing best practice through personalised medicine. And I'm delighted to see colleagues from Medicines Optimisation Innovation Centre as well today. Exchange opportunities, tackling global healthcare challenges together, and developing and improving on current service models and treatments. So that collaboration with our European colleagues is absolutely paramount for us. And on to my last slide for the time being. So this really shows that we like engaging with our UK colleagues too. And this is another picture from the Reference Site Collaborative Network Awards ceremony in October 2022. You saw in a previous slide there, myself and my colleague from Medicines Optimisation, Anita Hogg, accepting the award for Northern Ireland. But basically all 4 nations were awarded the maximum 4-star accreditation for their efforts, with a wide range of stakeholders in the respective regions, including service users, in promoting a lifelong approach to active and healthy ageing. And we think there's about 70 networks belong to this. So that's all from me for the time being, and I'm delighted to hand you over to my colleague Lorna for the next part. Thank you.
Thanks very much, Jaqueline. So, in terms of our department's vision for the people of Ireland, it's a healthier Ireland with improved health and well-being for all, with the right care delivered in the right place at the right time. Our mission is to improve the health and well-being of the people in Ireland by supporting people to lead healthier and independent lives, ensuring the delivery of high quality and safe health and social care, creating a more responsive and integrated and people-centred health and social care service, and promoting effective and efficient management of the health and social care services, and ensuring the best value from the health system's resources. So then moving to our strategic priorities, which you can see there on screen, a couple of which are to expand and integrate the care in the community and improving oversight and partnership in the sector. This works in tandem with our values, which are engaging with public service users, respect and fair and equal treatment of all, collaboration, innovation and forward thinking, professionalism, leadership and accountability, and integrity, impartiality and value for money. So then how do we do that? It's through enablers which include empowered teams and cross-functional working, data technology and digitisation, funding structures and infrastructure, innovation and stakeholder collaboration and alignment. These can all be applied to supporting the development of your PEACEPLUS programme. So, in terms of functions, the department serves the public and supports the Minister for Health, Ministers of State and the Government by providing leadership and policy direction for the healthcare sector to improve health outcomes, undertaking governance and performance oversight to ensure the accountable and high quality services, collaborating to achieve health priorities and contribute to wider social and economic goals, and creating an organisational environment where high performance is achieved, collaborative working is valued, and the knowledge and skills of staff are developed and deployed. So, in terms of our structure, we're led by the current Minister for Health, Stephen Donnelly, and he's supported by the Ministers of State, who are Mary Butler, who's responsible for mental health and older people, Frank Feehan, who's responsible for public health, wellbeing and the National Drug Strategy, and Anne Rabbitt, who's responsible for disability. In terms of our department structure, it's organised into 9 divisions, including the Office of the Chief Medical Officer and the Office of the Chief Nursing Officer. There's over 600 staff employed by our department, and we engage with agencies and partners across government and public and private sector organisations. These include the Health Service Executive, which has staffing of over 100,000 employees, the Food Safety Authority of Ireland and the Mental Health Commission. In budget 2023, 23.4 billion was allocated to the Department of Health, which is the highest health allocation in the history of the state. And there's an overall 443 million funding to continue to reduce waiting lists and facilitate access to care. So then looking at some of our key policies, a very important one is Sláinte Care, which is a reform of the health system to introduce the right care in the right place at the right time. There was cross-party support for this reform, which introduces universal health care and is person-centred rather than based on a person's ability to pay. It will also introduce 6 regional health areas across Ireland. And in July 2018, Government approved the Sláinte Care implementation strategy. The Sláinte Care Action Plan in 2022 sets out the ongoing reform priorities aligned with the Sláinte Care implementation strategy and Action Plan 2021 to 2023. The plan focuses on progressing the implementation of 2 key reform programmes, improving safe, timely access to care and promoting health and wellbeing and addressing health inequalities, moving towards universal health care. Another policy area is Healthy Ireland, and the Healthy Ireland framework was launched in 2013. It provided for the first time a cross-government focus to deliver the vision for a healthy Ireland where everyone can enjoy physical and mental health and well-being to their full potential, and where well-being is valued and supported at every level of society and is everyone's responsibility. It's based on 4 key goals, which are to increase the proportion of people who are healthy at all stages of life, to reduce health inequalities, to protect the public from threats to health and well-being, and to create an environment where every individual and sector of society can play their part in achieving a healthy Ireland. Another policy area there are many other policy areas that may be of interest, and these include Sharing the Vision, which is a policy for everyone to enhance mental health provision and supports. So then in terms of Ireland's priorities, the programme for government was launched in 2020 when the current coalition government was formed. It includes 12 missions, one of which is the Universal Healthcare Mission, which has 7 key objectives, and this includes Sláinte Care, promoting women's health and mental health. Project Ireland 2040 is the government's long-term overarching strategy to make Ireland a better country for all and to build a more resilient and sustainable future. The Shared Island Initiative was announced by the Department of the Taoiseach in 2020, and it seeks to harness the full potential of the Good Friday Agreement, enhance cooperation and connection and mutual understanding on the island, and to build consensus around a shared future. This is to be achieved by working with the Northern Ireland Executive and British Government to work on areas of cooperation on an all-island basis. So, in Budget 2021, the Shared Island Fund was developed, which committed 500 million to capital funding up until 2025, and this is ring-fenced for capital projects on a north-south basis. It was later announced that the budget would be doubled to 1 billion to 2030, which sets out investment priorities for the decade ahead to work through all island partnerships to build a more connected, prosperous and sustainable island for all. Under the Shared Island Initiative, a number of dialogues have taken place, and they're designed to capture what people feel and to be inclusive, increase opportunities and promote equality, cooperation and respect. 13 dialogues in a range of areas have taken place, including a health dialogue which took place in July 21. At this dialogue, the benefits of cross-border health care at Altnagelvin were highlighted, as well as cooperation between ambulance services. There were also panel discussions on 3 themes, which included cooperation on public health on an all-island basis into the future. There's also a research programme as part of the Shared Island initiative, and partners in this research include the Economic and Social Research Institute, or ESRI, and the National Economic Social Council, or NESC, and reports have included a number of recommendations, including how shared services can be better delivered on the island. So then, looking at our unit and how we fit into the work of the department, the North-South EU and International unit is broken up into 3 teams, each with their own distinct responsibilities. So the team that I lead is North-South and UK, and we lead on North-South cooperation, which obviously includes EU funding programmes, which is why we're here today, the North-South Ministerial Council and the Shared Island Initiative. We're also responsible for UK relations, including the Common Travel Area, and we also work on continuing Brexit issues, promoting EU and UK relations, including the Trade and Cooperation Agreement. We also work on enterprise engagement, and that's an innovation agenda within healthcare. The EU and bilateral teams support EU and bilateral engagement, and they're responsible for engaging with councils, including the European Council and EPSCO. They work with committees, including trade policy, social protection and pharmaceutical. And they also work with working parties and groups, including Health Promotion Steering Group, Pharma and Medical Devices Working Group. They also work with projects and themes which include EU for Health, which is another funding programme. The international team coordinates the department's engagement at an international level via the World Health Organization at regional and global level, the UN and other reporting, including the Human Rights Council and the Council of Europe, and they also deal with individual countries and their embassy queries. So then, moving to the EU funding programmes, both the Department of Health Ireland and Northern Ireland collaborate extensively as the accountable departments for health with the various EU funding programmes. Both Jaqueline and I both took up our respective roles in the last 2 years, and we've worked closely together and with the SEUPB and with our respective finance departments in getting up to speed on the current Interreg 5A programme. This programme has a funding allocation of 58.5 million across 10 projects, and as Jaqueline's already said, it's been a great success and the outputs have exceeded targets as of June 2022. Another benefit of this programme has been the takeaways in terms of the challenges that we faced during the COVID pandemic. The advancement in digital innovation supported all the projects to adapt during this pandemic to allow online service delivery as appropriate. And also the rollout of the mental health resilience programmes supported those living in isolation in the border areas during the pandemic, both emotionally and physically. So there's 10 programmes listed there. I won't go through them all, but just to pick out a couple of interests. The On-Site project was created to address social isolation experienced by disabled people, and its aim was to enable disabled people to create community connections both locally and online. I actually attended the closing event for that in September this year, and it was really compelling to see how this benefited citizens, particularly during the pandemic. Also, Empower, which supports healthy ageing through access to personalised care services and use of e-health and community support systems, which ensures older people 65 plus can live well, safely and independently in their own homes. And then my final slide here is just demonstrating how we've worked together on this. So this is from the closing event for Empower, which was the festival that took place in Belfast in April 2022 and was attended by colleagues from SEUPB, both Departments of Health Ireland and Northern Ireland, and colleagues from Scotland. So I'll now hand over to Jaqueline for the next slides. Thank you.
So now we're going to focus on why we're really here today, and that's the PEACEPLUS programme. And just before I go on, I'd like to say, and I'm sure I speak for you, Lorna, and colleagues in both our EU branches, North and South, this is a really exciting time for us, and we're delighted to have the opportunity to work with so many individuals on these cross-border projects, particularly given the challenges that our health service face at the moment. And we've had fantastic learning and collaboration so far, and we enjoy very positive relations with SEUPB as well. So we're hugely looking forward to as we move forward with PEACEPLUS. So, as you already know, £97 million worth of investment for this area, collaborative health and social care, 80 million available for this particular call, and as Declan was saying earlier, there'll be an additional call, hopefully in the new year, and that will focus on addiction treatment. So both departments, North and South, beg your pardon, we have, our major role is as an accountable department. We also assess, so that means we assess programme development and progress of successful projects through the life cycle of the programme. And we do enjoy a very constructive relationship and would engage frequently about both the progress of current Interreg programmes, many of which are closing now. Thank you. And also, obviously, we're looking at preparations for PEACEPLUS and the calls associated with that. So applications should align with relevant government and EU strategies and policies. They should also assess the potential for proposals to continue into the future, and they should be supported by evidence and include regular evaluation processes. I'd just like to draw your attention as well to a particular aspect of the call associated with this document, and this really helps focus us on what what the EU is looking for in terms of its specific objectives. So when it comes to project proposals, what you should be considering are those policy objectives. In terms of the EU policy objective, projects which focus on more social and inclusive Europe, implementing the European Pillar of Social Rights. A more specific EU objective concerns ensuring equal access to healthcare, recurring theme again about addressing health inequalities, and fostering resilience of health systems, including primary care, and promoting the transition from institutional to family and community-based care. And this should result in an increase in the number of episodes of care delivered on a cross-border basis. This will support positive health and well-being and the prevention of ill health through an integrated approach designed to reduce health inequalities in the programme area. And just a few key considerations, just to take you through those. So first and foremost, and you'll all be aware of this, is the importance of an integrated approach. We've touched a little bit on digitalisation, but again, new technologies were very significant when it came to help achieving some of the key outcomes in the Interreg programme. And the Department of Health here has just launched a number of key digital strategies earlier this year. Again, you'll find those on the Department of Health website. The need to tackle health inequalities, I'll not dwell on this any longer. I think we're very aware of how important that is. There's also an opportunity to develop and deliver cross-border health and social care research initiatives. And again, the requirement for specific mental health interventions. Two things we haven't mentioned this yet, which are very important and really unique, I think, to the Peace and Interreg programmes. And that's about projects adding value to existing statutory services and helping to enhance those. And the final thing is this programme's acting as a test bed for new pilots and new ways of doing things. And I think I hand over to you, Lorna.
Thank you very much. So we thought it might be helpful to bring you through the types of cross-border health and social care actions to be supported. So these include initiatives to develop cross-community and cross-border collaborative approaches to health and social care delivery in clinical areas identified as most suitable to a cross-border service delivery model. development and implementation of support and cooperation services on a cross-border basis for community and voluntary organisations involved in the provision of health and social care services within their own communities, and development of cross-border healthcare intervention trials. So then I'll hand back to Jaqueline to go through the final couple of slides. Thank you.
Oh, let me skipped one. Yeah, so just down to our last two slides now, and these are the sorts of areas that we're looking at and initiatives which are aimed at developing innovative interventions and delivery models in these areas. Now, I'm not going to run through them all because you will find these in the PEACEPLUS programme, which you can find on the SEUPB website, and they'll also be in the document, the call document, which is associated with this investment area. So I will leave you to ponder those. And then finally for today, again, just to come back to the real purpose for this investment is to build upon existing and new cross-border collaborative approaches to health and social care delivery models. It's to deliver an increased number of episodes of care across the programme area, and this should support the development of innovative community-based healthcare interventions which complement statutory provision, which we referenced earlier, including social enterprise models. Something, finally, that we haven't quite touched on yet either. Projects should be cross-border in nature, for, by example, using staff from both sides of the border. Oh, sorry, I haven't moved the slide on there. Apologies for that. It should also be open to, projects should also be open to users on either side of the border. And you can also look at using a shared approach design on both sides of the border. And finally, just to say, health and social care interventions, services and initiatives should be new and not continuations of existing services. So it just remains for me to say thank you so much for listening. Hopefully this was of use. Lorna, thanks also to you. That was an enjoyable double act experience. And do you have anything that you'd like to add, or we'll just wait and see if we have any questions later on?
Nothing to add, just to say thanks everyone for your attention today.
Thanks very much.
Thank you.
Thanks very much, Lorna and Jaqueline. And I think it's really important to hear that, the messages that both departments have given you today, and the very informative presentation there. I should have said at the start, everything, all the presentations from today, and indeed we're also recording today's event, will be available on our website. We'll have that available in advance of Christmas. So I know you're probably busy trying to make notes and things like that, but it will be, you will have an opportunity to view the video again if needs be, and also the presentations will be up on the website as well. The other thing as well is there will be time obviously for questions, and we'll do that at the end if that's okay. So if you have got questions or things that you want to raise, please, if you can make a note of them, and we'll take those just at the end of Myriam's presentation. I think it's important just that you see the full extent of what we're proposing and what we want to do in terms of the concept and the process, and then we'll take questions after that. The other thing I would say as well is, look, whilst the overall programme has been approved and adopted by the Commission at the high level, there is still work to be done in terms of the processes that we will use to implement the programme. So, for example, the programme rules, we're developing a programme manual which will contain a set of rules for this programme period at the moment, and there's still some work to do in terms of finessing that, really, and there's issues that obviously are coming to light that maybe we need to address and build into the manual and the rules as well. So I just say that just to give you a little bit of context on that before we take questions later. We'll also publish a set of frequently asked questions as well on our website. They probably won't be available until January, but again they'll feed into this overall development process now that you're all engaged in. I think just to pick up on one thing that Lorna and Jaqueline mentioned, and I think it's really probably the really important point, is about added value. And I suppose, again, to really think hard about what it is that you're developing from a project perspective and how that aligns with what we want to see ourselves and the departments within the programme and projects coming forward. But it's always, I think, about where does the PEACE programme add value to what you do and, you know, the projects that you're thinking of. So just important just to, I think, reinforce, I think, that important message. So look, what I'm going to do now is welcome Myriam Fearon. Myriam, some of you may be familiar with, and Myriam is going to be working with ourselves and yourselves over the next number of months around the development of the projects. Myriam's here very much to support you on that process of development and the pre-application support, so she'll outline some of that in a moment. But please do use the resources there in the months ahead. You know, it's not a requirement, a formal part of the process, but it is something new that we've introduced this time round, and I think it's worked well in other investment areas to date, so hopefully you'll see the benefits of this support in the months ahead. Myriam, thank you.
Good morning, everybody. Delighted to be here and working on the pre-development support process, which I think is really, really helpful. I've had some experience of working on some of the other calls, and I think it's really, really worked well. It's a great opportunity for you as projects. So before we talk about how that is going to work, let's just take a quick revised kind of look back over some of the things that Lorna and Jaqueline have said about the call itself, okay? So the specific objective for this area of the PEACEPLUS programme is collaborative health and social care, is to ensure equal access to health care and fostering resilience of health systems. And what that's going to result in is an increased number of episodes of care delivered on a cross-border basis. So in terms of how that's going to work, Declan has outlined this is a successor programme. It's building on one of the most successful parts of the previous Interreg programme. We want to see the continuation of those really effective cross-border collaborative partnerships in health and social care and the creation of some new ones. Okay, so in terms of who can apply, Jaqueline has just emphasised it there. You must be a cross-border collaborative project, so you must be a partnership with cross-border partners. You must be well positioned to kind of to deliver out on a healthcare project that will be impactful. You must be resourced to do that, and very important, this is a time-bound programme. You must be able to deliver your project in approximately 4 years, so you must be in a position to do that. In terms of the range for this particular part of the programme, and Jaqueline and Lorna mentioned this, but just to give you the sense, there are 10 clinical areas that projects can be based on, and they are obesity management, renal services, addiction and suicide prevention, medicine management, respiratory services, coronary care and heart failure, geriatric medicine and the complex needs of older people, mental health and resilience, particularly important in the context of the PEACEPLUS programme is the resilience, children's mental health and social inclusion for those with disabilities and their carers. So those are the 10 clinical areas that we are looking at. In terms of measuring change, your project needs to result in change and positive change, impact. You need to be able to measure that, and you need to be thinking about that now at the design stage. Really important that your project is beneficial, obviously from a health and social care perspective, but also that it really aligns with the aims and objectives of the PEACEPLUS programme, which is all about building peace and prosperity. And it's important to connect. I know myself, when you're in a particular kind of area, you're focused as you are in health, but you've got to look at the context of that within the PEACEPLUS programme. Lorna and Jaqueline have been very good in terms of outlining what the strategic aims for both the Departments of Health and the island are. It's important, even at this stage, to be linking in and showing how your project will link with those aims and objectives at that statutory level. Okay, so PEACEPLUS is a result-orientated programme, so there are result and indicators for all parts of the programme, every individual investment area. And for collaborative health and social care, the output indicator is 9 jointly developed solutions. Okay, and the result indicator is 80,000 beneficiaries of jointly developed and delivered health care and social care solutions. So as you're developing out your project idea, you have to then assess how your project will partially contribute to those overall result indicators. And you need to be thinking about that right from the very, very beginning. Okay, so in terms of the indicative actions, Jaqueline has outlined those for you. So you need to be thinking about those just collaborative cross-border projects across all those individual clinical areas. In terms of the pre-application support and concept note, so I think this is the 4th one we've done of these, guys. So in terms of, oh, apologies, guys. I didn't realise it wasn't moving on. Luckily, as Declan says, you will be getting these slides, so don't worry about that. So, in terms of just how to use this process, so the first thing to do is you're all in a room together, and as Declan says, some people have come and they know they're with their partners, they know what they want to do. Others are here with a good idea, with an important healthcare area, and looking at how they can engage. So now is the time to start looking around. There will be people in the same position, and SEUPB will do what we can to facilitate that partnership working and developing from now. Important at this stage to start looking. We're giving you a good outline of the programme today. Decide is this a good fit for my project? And some of you are building on existing projects, some projects are new, but look back over what we're presenting to you today and assess, is this the right fit for me? So in terms of how the pre-development support works, you can ask for, we're going to ask you to develop a concept note, but you can speak to me and arrange a meeting with me first to talk about the kind of outline of the project. And I think fair to say that people who have taken that approach, it has been very, very beneficial, and it has probably strengthened the concept note they have subsequently submitted. So you do have the option to speak to us in advance of preparing the note. Once you do prepare that note, we will then come back to you for with feedback and speak to you about the content of that note itself. But early engagement is welcome and very much encouraged. Okay, so concept note is available on the website. It can be downloaded. It's a very, very simple form, really, guys. And so from today, the 12th of December, any organisation interested in becoming a lead partner under this investment area can complete and submit a concept note for comment, advice and support. So it's very high level. There's 5 questions. It'll cover some of those kind of main questions you're going to be asked in your application form, but not all of them. It's very much about you putting the outline and the core construct of your project in writing. So it's quite high level. But it will really kind of help you develop the foundations of what your project is going to be. It is not a formal application form, so it is not scored. It will not impact or have any, won't have any impact on you submitting an application subsequently. It's about getting advice. And I think I attended the first, the 1.4 pre-development support workshop, and I remember Gina McIntyre, our CEO, saying, like, why would you not avail of this opportunity? And I think it's true. It's a really good opportunity to get some feedback on what your project is. Okay. So the good news is it's very short. Okay. So it is a short form with 3 pages and 1 page of guidance, which is specific to this particular investment area. So it's very high level. Each of the 5 questions are between 300 and 500 words. And I would ask you as much as you can to fit within those within that word count. It's a discipline sometimes to describe your project concisely, but if we're to really give you the best feedback we can, we need you to stick within those word counts if you can, okay? You'll be able to return it to me at the email address there, and it is to be no later than the 8th of February. But I was asked the other day, can it be up to midnight? And it absolutely can, so there's no problem there. Okay. So let's look then at what the 5 questions are and just give you a sense of the type of information we're looking for. So the first is really telling us about your project, okay? So how has the need been identified, okay? How does your project align with the PEACEPLUS programme specifically, okay? And as all colleagues have reiterated, your project needs to contribute to more efficient delivery of health and social care services across the programme area. It has to enable people to access quality health and social services in the most appropriate setting to their needs. And it has to build on collaborative and cross-border relationships and service provision where that is possible. Okay. The other thing, and again, the departments have mentioned this today, just important to emphasise how your project incorporates, an integrated approach. It's adopting new technologies to improve access to services. It's managing cross-border research where that's appropriate to the intervention. It's tackling healthcare inequalities, which is particularly important within the PEACEPLUS programme. And where appropriate, it's incorporating specific mental health interventions. Okay. So we have mentioned earlier that PEACEPLUS is a result-orientated programme. We've talked about the result and output indicators specific to this call. This next question is where you outline how your project will make a contribution to those output and result indicators. So you need to tell us how your project will result in a jointly developed health and social care solution. And it's very important that this is a new solution and it's not a continuation of an existing service. Same, we need to know how many people will be engaged. We have a target of 80,000 beneficiaries for this particular investment area. So you need to tell us very clearly how many beneficiaries your project will result in. Okay. And again, important to note that, that the beneficiary can only be counted once they receive the course of intervention, service and initiative, i.e. they've had an episode of care. Okay, so cross-community and cross-border dimension. First of all, you need to clarify and confirm that your project is cross-border in nature. That's totally critical. You need to tell us how and what geographic area your project will cover. And you need to tell us how your project will be jointly developed and delivered. So it has to be designed on a cross-border basis, delivered, and that means jointly staffed on a cross-border basis, and that it's open to beneficiaries on both sides of the border. Okay. So in terms of question 4, that's all about describing who will be delivering this project. Who are the proposed team, the partners, what are the implementing arrangements. So who will staff the project? How are they suitably experienced to do that? What are their qualifications? What previous experience have they got? What are the practical arrangements for implementing the project? And what is the rationale for partner composition? And as someone who looks and regularly sees project proposals coming in, you'd be surprised that it's not always made clear why particular project partners have been included, what their role is going to be. So I would really advise you to be very, very clear about that so we can really assess the value of the composition of your particular partnership. Okay. The final question, and you won't be surprised to know that it will get a lot of marks in the subsequent application process. Value for money is really, really important in the context of the PEACEPLUS programme. So we need to know that your project is appropriately costed. So, for example, if you are including staff, are those staff at the market kind of norms in terms of salary scales, etc.? Okay. Where possible, have you included the potential to incorporate competitive tender, if that's appropriate? Show us an outline in terms of value for money, how your project will contribute to the achievements of the result and output indicators is a big consideration in terms of value for money. So again, it's very important you illustrate that. In terms of exit strategy and durability of results, I suppose continuation, longer-term sustainability of your proposed project in the context of health and social care is very, very important. You know, so that long-term impact. I think Jaqueline mentioned again the importance of ensuring that we are adding value. We are not displacing. We are not duplicating. We are adding value and bringing that cross-border added value in particular to the project it is that you want to progress. Okay. So, in terms of the lead partner role, and I'm sure we have a number of very experienced lead partners in the room, but really just to emphasise that what that involves, if you are a lead partner, your responsibilities are as follows. In terms of the project, you're responsible for coordinating all of the communications, the financial management, any training, the reporting, which is particularly reporting generally, but particularly reporting in terms of the result and output indicator achievement, any policies, procedures relevant to your project. So in short, overall, you're accepting overall responsibility for the successful design and delivery of the project you're proposing. Okay. So things to bear in mind. So I think, particularly in comparing this to the previous programme, now is a great time to actually, before the application process opens, to really take time to consider your project, to build your partnership, be very clear on who is doing what, why are they doing it, why are they the most suitable partner to perform that particular role. Start thinking about how you will, manage the communications of your project, but particularly monitoring and evaluation and how you will build that into the project design, very, very important. We're looking, particularly in health and social care, which is such a crucial part and an area of importance for all of our lives. We are looking for people and partners to be ambitious, but we also need you to be realistic. So be careful to be kind of realistic rather than biting off more that you can chew. So make sure that the project that you're proposing is at an appropriate scale for your partnership in order to be successful. Something very important, we've talked there about 10 or 9 solutions. We have an investment for this particular area and this call of €80 million. So we are looking for projects of scale. And in order to kind of manage projects of that scale, you need to be thinking at this stage how you would manage cash flows and, working through how that might work. Okay. Important to have clarity of purpose. Your project must always consider the focus on peace and reconciliation and peace and prosperity. So again, just to reiterate, come back to what the aims and objectives of the PEACEPLUS programme overall are and how your project will help achieve those aims and objectives. Okay. So, in terms of the timescales, so just to re-emphasise, the concept note you should be able to download from the website from today. Again, you can contact me at any stage from today. You can decide to do that before or after you've completed a draft concept note. That's very much up to you. But once you formally submit your concept note to us, we will aim I keep saying we, and I think I was going, I will aim, I will ensure, it'll be up to me to come back to you as much as possible within a 15-day turnaround. So that's what we'll be working to do. And then further support, we'll assess on the basis of what you've submitted, what your need for further support is. But just to re-emphasise again, well, before to be mindful of, we're dealing with a very high level concept note at this stage, but to assure you that in advance of the call opening, you will have access to much more information in terms of the PEACEPLUS cooperation programme, the programme manual, the guide for applicants, and the actual call for this particular investment area, so the 4.1 call, okay? But really, this is a great opportunity, and you know, there's a bit of a discipline to it for sure, to actually describe your project very clearly, very concisely across 5 short questions. And in that way, we will do our best to give you as much advice and guidance to ensure that the application that you subsequently submit is as strong as possible and has the highest chances of success possible. And our experience of the other pre-development support areas has shown that the process works and it's beneficial for everybody, yourselves, SEUPB and the departments as well. So I really look forward to working with you all to make sure we can do that. Okay?
Thank you very much. But before we get into questions, I'm going to just point out a few significant changes. For those of us who've been involved with the previous Peace programme and the Interreg programme, there are some significant learning that we're taking forward into the PEACEPLUS programme. One of the key issues is around the FLC. So this is the first level control of the expenditure. That is going to go to the lead partner. So in practice, the lead partner will verify the project partner expenditure and SEUPB will verify the lead partner's expenditure. That's just some of the sort of learning from the existing process where we're trying to expedite the timeline. So that's something that you'll need to consider in the development of your proposal to ensure that you have costs built in to your proposal to cover those verification costs that you'll have at a lead partner. We have a new EMS system, which is a system for submitting applications. It's called the GEM system, the Joint Electronic Management System. That system is up and running. A few of the other programmes across Europe that were referenced earlier have already used this. So we have the application module ready to go. We are actually currently reviewing the reporting and progress modules at the moment. So that's all up and running and hopefully will make the process a lot easier to submit your application. We also have some standard unit costs and they will be detailed in your call document, but we're likely to go for flat rate for overheads, flat rate for TNS, those sorts of things. Unfortunately, until we have a PMC appointed and the programme manual and all the associated documents, we can't share that content with you until that point. We were also aiming to have a database in place to monitor impact. So you'll note this time the results and outputs are very high level with participant data and jointly developed solutions. Within that, we're aware that certainly the sectors that you're operating within, there is a real sort of push towards outcomes-based accountability, impact, all of that. So we are currently in the space of developing a impact database, which will help you with demonstrating your project's impact. All will become clear in due time, no doubt, and we'll navigate the myriad of GDPR and all of these different issues. So just a few points that I just wanted to make, practical points in relation to the delivery of your projects. I'd like to open it up now for questions. We are all available here and we will be available in a round afterwards also to have one-to-one questions. For the purposes of those who are reviewing this online, respectively, can you please use a microphone and state your name and your question? Anyone with any questions to get us started? Oh, thank you. Just over here.
Maura Keith from the Empower project. Presumably the expectation is that the number and the value of the expressions of interest, if you like, will exceed the amount of funding that's available. Will the process refine and guide projects or proposals where there are similarities or synergies? Will they guide those projects together and kind of indicate who would be a preferred lead bidder?
Yeah. I'll refer that one to Declan.
It's not. No.
Okay.
One second. Hopefully you can hear me. Okay. Yeah, I mean, that will be part of the process, you know, in terms of, I suppose, part of this from our, obviously is to help yourselves, you know, and that's the primary kind of factor here. But it's also beneficial for us as well because it gives us some intelligence in terms of what's coming down the line. And I suppose, look, I don't think it's in anyone's interest that we end up with a lot of projects in the same space that potentially could be working together. Now, look, ultimately, it's a decision for yourselves, you know, as partnerships and projects, you know, in terms of, you know, what way you want to go. But certainly from Myriam's perspective, one of the asks that we're asking Myriam of is, you know, to engage in that way. You know, so if there are similarities, if there's linkages that can be made, then we'll certainly do that. And, you know, at the end of this process, you know, it's a one-stage application. You know, it's not 2 stages like the current programs. So we want to make sure when that call opens next year that the projects that are coming through have the best chance really of succeeding, that they're of a sufficient high quality, you know, to ease that process as much as possible. So certainly that will be part of what Myriam will be doing over the next number of months, is to look to see what's coming in. And if there are linkages that we can make, then we can certainly point people in that direction. But ultimately, you know, it's a matter for yourselves as partnerships. So we can't tell you to do that. You know, it's up to yourselves to make that call on what you want to do, because it is a competitive funding call, you know, at the end of it all. I don't know if Myriam or Paul want to add to that.
I would only add that certainly under the 1.3, the regional call, we have seen, where we have seen synergies, or my colleague Emer, who's doing the same role, where she has seen synergies of that nature, she has signposted people and encouraged them to collaborate.
Thank you very much. Any other questions? Or, yep. Great, we'll just get a microphone to you.
Thank you. Kevin McCahan, Red Cross. Just picking up on that question, really. I find there's lots of people in the room here I don't know, and we're not wearing any badges. So I wonder, is there any possibility that there could be some sort of circulation of the people who attended today? Certainly we haven't got a partner in mind at this stage, so we're looking for others who have other ideas. I don't know if that's possible to share who attended.
Yeah. Well, yeah, we can certainly look at that. I don't know where we stand in terms of.
No, I understand. I understand. But it would be useful because there's lots of people in the room here I don't recognise. But my second question is really related to the last. Given there's a budget, as I understand it, of 80 million, is there sort of a ballpark figure where you see a project coming in? Did I pick you up and say, did you see 9 projects funded? Was that right? So are we looking then at projects not sort of 10, sort of 7, 8, 9 million sort of pounds?
I think look, it's difficult to give you an exact thing, and part of this will be to see what's coming forward. But I think, you know, in the region of 6 to 10 million, something like that could potentially be where we're looking at. But having said that, you know, there can be smaller projects and there can be some larger ones as well. It's very hard to,
of course,
at this stage, to really set that in a kind of concrete manner.
Yeah, it was the figure of 9. I just wanted to clarify. I mean, that's really good. Thanks very much.
9 solutions for this particular call.
That's great. Yeah. Thank you very much for your help. Thank you.
I suppose on your first, just going back to the first point about you know, the attendance list and everything else, we'll see what we can do in that and what's possible. But what I would say as well is, look, you can, as far as I understand, you can go onto our website, you can put your details up. So if you you want to invite interest yourself as well, if there's an idea or just even your organisation, then we can do it that way as well. So we'll get around it.
Thank you. Yes, another question?
Hello, how you doing? Stephen Barr from Start 360. Paul, just a question in terms of your AFLC. Is there going to be a flat rate affixed for the administration process and that, or a threshold agreed, sustain the learning from Piece 4?
We're certainly looking to have flat rates for things like overhead and T&S costs. There might be some specific costs that you have ideas on that we could attribute a flat rate, and this is partly what the concept note process is about. If you have a proposal to use any flat rates that are out there and existing or in place, come and talk to us about that and we will try and learn from there. In terms of the flat rate for the verification costs, no, we don't have that as yet. Something that we're looking at and we're working on in the background at the moment.
Yeah, I mean, the two ones that are definite is overheads. There will be a flat rate, the same flat rate that's there for the current programmes. I think the other thing then will be the new one that will be introduced is travel and subsistence. And it's very likely that will be set in around the sort of 6-7% mark. So off your direct salary costs. So that is a good simplification. I think it's been brought in, it's in the regulations from the Commission, and we will use it, because, it saves all of that verification in terms of those travel costs, during the implementation stage. So that will be all outlined, within the call documentation when it comes out.
Hi, just Patricia McGee from S3 Solutions. I'm just wondering, in the presentations you've really reinforced the cross-border element, obviously with it being PEACE, and I know previous programmes have really reinforced a shared contact between cross-community. I'm wondering, have you agreed a stipulation of the amount of hours contact that would be required, or if that is something that's considered under this?
Yeah. Yeah, I'll maybe take that one, Paul. I mean, there is no requirement on contact hours or anything like that. Now, if you were a plan in other parts of the programme, there potentially would be requirements around that. I suppose the point is, it's about peace and prosperity. So you'll hear us going on and on about this, I think, over the course of the next, 12 to 18 months as these calls open and close and everything else. But if you look at it at a kind of more strategic level, it's really trying to articulate the importance of improved health and social care services in rural communities and urban places, cross-border, how that collaboration is leading to a more sustainable, more prosperous, better life for citizens, north and south. So it's set that in that context that you need that sustainability, the more prosperous society, better services, and that will then have a knock-on effect in terms of the peace outcomes, peace and reconciliation. So in this area, we're not actually saying that you have to have cross-community contact in the way that, a number of contact hours. It's more about that more strategic picture, how through your project, through the improving services on a north-south basis, how that's going to lead to a more peaceful society, ultimately, for all of us.
Okay. Any further questions? Great.
Thanks. Conrad Mulrennan from the Atlantic Technological University. I was just wondering, so under the initiatives with all the clinical themes that are chosen, there's many chronic illnesses, but there are also several left out. I was just wondering, because of the focus on rural and community care, are those all excluded? Diabetes springs to mind as one that's missing off the page.
I think the main areas of focus are what you've seen. That's where the focus is, and that came out from the development of the programme. And that's written into the programme now in terms of those different areas. That's what's been approved by the European Commission. So that's what we want projects to focus on. So I think that's the primary areas. There may be some flexibility around that, in terms of, and we'll be interested to hear, when you're discussing this with Myriam over the next number of months, and we'll reflect on that and go away and think about it, and come back with further advice and guidance. But what I can say, look, what's in there and what you've seen in the presentations, that's what's going to go into the call documentation, and that's what we'll require projects to meet. But we'll see if there's flexibility around that, just as you're having those discussions over the next number of months.
Okay, any further? Great.
Mike Scott from the Medicines Optimisation Innovation Centre. Just following the same thing, Declan. People have multiple long-term conditions in, so you're going to have significant overlap because they're going to have older citizens with 5 or 6 things, problems with them. So they've got a respiratory condition, heart failure condition, they've got diabetes. So there obviously is great opportunities across this. Just how would you look at that in a patient-centred focus? Because they're going to 6 things wrong probably if you're over 65 or something like that.
But I suppose, look, this is what we're saying. There may be a degree of flexibility here. The areas of focus we've outlined, I think, how this then develops in terms of what you're telling us, in terms of this is what this space now is about, really. And I know we've done that in other areas of the programme. We had workshops back in September there for some of the other calls. We've went the way, we've reflected on it. We need to provide more information, more clarity. So we're more than happy to do that, and work with our colleagues in the 2 departments on that as well. So look, whatever your ideas or to come to us with it, and we'll see, how we can kind of work together in terms of where that goes next time.
Hello, Alan Connor from NHS National Services Scotland. Thank you for all the presentations. Special thanks to Jaqueline and to Lorna for calling out the Empower programme, which we're very grateful for. You won't be surprised to hear, as we led it. Also worth mentioning, we're very grateful for the emphasis on the functional areas and our ability to contribute to the programme, even though we're not in the programme area. One of the things I'd like to expand on, and I don't know if tension's too strong a word, but that balance between projects that have been successful in the past and building upon Interreg 5A projects and actually ensuring they're new. Now, is tension too strong a word, or is that something we can work up with Myriam and we just need to be careful of repeating ourselves? It's an interesting area, though.
Absolutely. Look, colleagues might want to come in here as well, but we've all, I think, said at various points this morning that we do see this as building on the good work that's been there before. And there's been, I don't need to tell you this, I mean, there's been some excellent projects. And there's still a need maybe to go further, in terms of the areas of focus. And look, you see in terms of the areas that we've noted, there's a lot of similarity there to what was funded under Interreg 5A. That's for a reason, come out of the consultation process, that there was still a need to develop further and go further than what the projects have done under the current programme. So we do want to see some new projects as well, though, yeah, it's about getting the balance, I suppose, and again, it's part of this. This is a real opportunity for us as programme managers as well as yourselves in terms of the work that Myriam's doing, because we never really would have had that intelligence before in terms of what was coming forward. So we really use that. And back to I think the first point that was made, in the questions, it's about us kind of trying to work with you on that as well. And if we think something that gets too similar, it doesn't go beyond what was there in the current programmes, it doesn't add value, then we will say, that's what Myriam will do, and we've asked Myriam really to be a critical friend, because we don't want to waste anybody's time here either. I think you won't want that, we don't want that. So look, it's about using this process now over the next number of months, really, just to try and refine and reflect and to make sure that we've got the best high quality projects kind of coming into that call process.
I would just add to that the health theme has traditionally seen the most successful projects go on to be mainstreamed, and that is, quite unheard of when you're in that cross-border, cross-community space that we've been working in. So, I'm really hopeful that existing interventions are moving on and the learning is being mainstreamed. Should it not be, let's hear why not, and let's see what you're doing differently to take the projects on to the next level and hear about that. And I think, again, it's just about elevating it. And again, going back to that peace and prosperity angle, I think this is going to be a challenge for the traditional projects that were in a slightly new space of building peace and prosperity and evidence in how you're going to build peace and prosperity.
No pressure.
Michael O'Brien, I'm from the HSE EU North-South Unit. Just one question I have is around the whole e-health agenda, and I suppose at an EU level at the moment, EU for Health, for example, is looking at development of QR technology, smartphones, that whole area. Can we get maybe some indication of what the PEACEPLUS programme would expect of applications from the point of view of, I suppose, sharing of patient data and maybe other you know, are there new developments that the programme is specifically expecting this time?
I suppose I would probably defer to my colleagues in the department as they look at me going, yeah, we need to align with strategic policy, north and south around this, and then how do we add from an EU angle? I don't know, Lorna, Jaqueline? Yeah.
Yes, thanks, Michael. I feel like I should just talk to you without the microphone, but for the benefit of the room, I did refer, I think, to our colleagues in the Chief Digital Information Officers department. They have been very hard at work developing not just one, but a main digital health and social care strategy supported by 3 strategies which focus on the types of area I think you mentioned, Michael. So I would recommend people really go through those strategies and see exactly what the department is hoping to achieve from its own point of view, and then I'll very happily refer you to my colleagues in CDIO. But yeah, that would certainly be one recommendation.
Yeah. Yeah, I think, is it Dan West that's taking forward a lot of that work? I suppose what I would say is that any solution that's developed can't be back-to-back. It has to be cross-border in its very nature so that it services and works and integrates across both platforms, north and south. Okay. Any other questions? I'm conscious we're about 10 past now. I don't know if you want to say anything further, Declan? Just closing remarks. Okay.
Thanks very much, Paul, and thanks to everybody that asked a question there. And look, you may well be sitting there thinking you might have other questions and things. As Paul said, look, we'll be about for the next hour or so over lunch and that. So please do speak to myself, Myriam, Paul, our departmental colleagues as well if there's any other questions. As I said, we will put up frequently asked questions up on the website as well in January. So that's something that you can keep an eye on as well. So look, just to close off on things, and just to thank everybody that's been involved, in particular the speakers today from the departments and my own colleagues that have organised today's event, and obviously then just to thank yourselves for your attendance. We will have the video up on the website before Christmas and the presentations as well. So do go back and reflect on those when you need to. So just to wish you all a very happy Christmas and a safe journey home. And there'll be some lunch outside as well if you can stay. Thank you. All the best.